Hi, this is Neetu here from Autoimmunity.in. We're back today with two special people. Before we get into that, I'd like to tell you guys a little bit about what autoimmunity is. Autoimmunity is a community that brings people together that have autoimmune illnesses and their caregivers. This is a platform for them to be able to connect with each other, to share important updates about their lives, and also share inspiring stories so that we can keep each other motivated through our individual journeys. Welcome aboard, Dr. Sidharth and Dr. Prashant. Just to give you a little heads up on what Dr. Sidharth and Dr. Prashant are about, Dr. Sidharth is a childhood friend of mine. We go back a very long time, and he's my best buddy in all through thick and thin. As a profession, he is a pediatric critical care doctor, and so is Dr. Prashant. Dr. Sidharth, would you like to take over and tell us a little bit about yourself?
Sure. Thank you so much, Neetu. This is a phenomenal opportunity, and it's my privilege to be here. So thanks for thinking of me. So Dr. Sidharth's a bit formal. Just call me Sid. Officially Dr. Mahapatra, but just call me Sid. Yeah, so I'm a pediatric intensivist. I work in the pediatric ICU, and I trained with Dr. Prashant at Stanford University, and that's where we met. And we're going to discuss our journey there with one of the patients that you have been kind enough to interview. Aside from being an intensivist, I actually also have what's called a wet lab. So I work in a research lab at the University of Nebraska Medical Center. And my research isn't in autoimmunity, although I do look at the immune response with respect to pediatric brain tumors. You know, unfortunately, Nebraska, where I work, has a very high incidence of brain tumors in children. And so I'd like part of my life's work to be in trying to help those kids. So that's kind of just briefly about what I do. Back to you.
Wow. So Dr. Sidharth is, or Sid, as you'd like me to call him, has given you a little heads up about what super stuff that he does in his profession. Dr. Prashant, you want to tell us a little bit about what you do, where you were based, how you know Sid, and how we all got together here?
Yeah, sure. Hi, my name is Prashant Purohit. I'm originally from India, and I came to Hawaii to do my pediatric residency. And then I did my pediatric critical care fellowship with Sid at Stanford. And then I came back to Hawaii because they had an opening. And so it's good to be back in Hawaii. So I work in the pediatric intensive care unit as well as pediatric critical care physician. And my research area is in the pharmacology and pharmacokinetics. So basically, my overarching goal is to improve the safety and efficacy of the medication administered to the critically ill children. So it's a little broader subject, broader research project, which involves all type of medication that also involves autoimmune diseases as well. Yep, that's all about me in brief.
Wow. So we're all here together today. Since I reached out to Sid here, as I said, my best buddy here, and I mentioned to him that I am an autoimmune patient. I have autoimmune hemolytic anemia, and I have been living with this condition for over 20 years now. I primarily have lived in India. My childhood has been abroad, but after which I have been living in India. And I wanted to build this community, and he was super enthusiastic about it. And from the moment go, he was keen for me to be able to connect more people on this platform. Through this effort, he introduced me to a patient that Dr. Sidharth as well as Dr. Prashant have worked with of lupus. And we have her interview up separately on our channel. Since I have already interviewed her, this interview or this discussion is more or less trying to understand the medical side of what lupus is all about and how this common friend of ours miraculously came over her journey with lupus as an autoimmune illness. So Dr. Sidharth, would you like to tell us how you met Devanshi and what this whole thing is about with Devanshi when she was really young? Where did you meet her?
This is one of the clearest patient encounters that I've had. And we've stayed in touch ever since her discharge. And I am so happy to say that and you can see from the channel itself that she's grown up to be a very beautiful young lady who you would not even believe actually suffered something almost life-threatening.
Yes.
So the reason that her journey was especially important was because it came at a time where Prashant and I were in a critical time in our training. We were basically, I believe at that time, and Prashant, correct me if I'm wrong, we were senior fellows at the time.
Right.
So we were kind of getting ready to become independent, but we were in the last year of our training. And in the last year of training, you're given quite a bit of independence and autonomy so that you can develop your skills of leading a critical care team through the process of taking care of very sick children.
Right.
And so Devanshi came into our care, into everybody's care for that matter, in the ICU. Yes. But either we took a special interest to her or she took a special interest to us, maybe because initially what connected us was our common culture.
Yes.
She was Indian, we're Indian. And, I was born in India and I had a very, very, very strong connections with India. So the medium of communication was very easy. Sometimes they would, just devolve into Hindi and it was very easy to kind of connect with them. Right. We understood their apprehensions of, why did they not want to go down the diagnosis even of lupus, because it was not something that South Asian families are used to thinking about.
Absolutely.
We, for better or worse, think it's a affliction of a third world country, of a first world country, of people that have more privilege, that they're the ones that suffer mostly autoimmune conditions. And in other places, it's not really thought of as a mainstay of problems, maybe because education needs to be improved. Awareness needs to be improved. And, through your life's work, you're doing that. And I'm very, very happy to be helping you with that, because these individuals need a voice. They often feel alone and isolated. And they don't realize that there's a lot more of them than they know. Exactly. So, the family itself was having a very hard time accepting the diagnosis. Now, I'll remember very clearly, I was on call and I learned about a child that had come in that the renal team, the kidney team, had admitted into our ICU. Yes. Because they were worried that she had pretty bad systemic lupus erythematous, SLE, or lupus for short. Right. And it had primarily affected her kidneys and had caused her to go into renal failure. And so that would be an obvious and a very normal admission in an ICU, in a pediatric ICU. So for us, it was, I hate to say it, but it was bread and butter, right? It was something that we are very used to taking care of, and we knew kind of what the protocol was. So there we were, or there I was, kind of initiating the protocol and really not very conscious of the real struggle behind it all, which was even the acceptance of the diagnosis. Right. And so that was an eye-opener for me as a trainee, because everybody else that I had encountered, they didn't have a problem if I diagnosed them with a bad infection or a cold or something that required intensive care. But here was an Indian family that was resistant to that diagnosis, that they didn't really believe that was the case. Yeah. Now, to a physician who has the evidence, who has the data, they're in one mindset. And so we become very pigeonholed into diagnosis and treatment and management because we want to get our children better. We want to get them better. And that's the most important thing for us. Sometimes we fail to realize that what might help them get better is to actually slow things down a little bit, go back to basics, find out what is the struggle here in the understanding. And so I remember very clearly being in a hallway and discussing the diagnosis and the seriousness of the diagnosis with her mother. Attendings moving beyond us and across us and giving us kind of the knitted brow, like what's going on here? It looks very intense. It looks very involved. But I took them in for my very own and wanted to really impress upon them how important this was, because there was a child's life on the line. And not just because she was an Indian child, but only simply because she was a critically ill child that was in our care. And so that's kind of how it started. It was a little tumultuous in the beginning because there was lack of trust from one side, and there was a lack of understanding as well. And I think that started a very important journey within me that has kind of shaped what I am today, of remembering that just because you have a diagnosis and you as a physician accept it doesn't necessarily mean the patient and their family is ready to accept it.
Right. Right. So Dr. Prashant, Dr. Sidharth has sort of given us an idea of how Devanshi came into the ICU, and just like any other patient, a doctor would approach her in this typical standard manner. What was your sort of experience the first time you met her, the first time you saw her? What were your worries as a doctor?
Yeah. Sid has given a very good introduction that initially there were a lot of diagnostic challenges, and then family had hard time accepting it.
Yes.
When Devanshi came under my care, she was already intubated, meaning she was on the mechanical ventilation. She had developed lung problems and she was having breathing problems. But by that time, Sidharth and his team has done such a great job that by the time family had accepted the diagnosis and they were prepared for everything. And they were very flexible about the outcomes and the things were happening, and they were very acceptable to the plan that we were making. So what I would say is I would endorse what Dr. Mahapatra and his team had done a very great job at that time. And then because of the culture and it was very easy to communicate with the family and the language, like Sidharth mentioned.
Yes.
And afterwards, I remember once we were able to successfully get her off the mechanical ventilation, and then she was doing well. She was sent to the pediatric floor, but then we had that relationship. So, because of this chronic condition of her lungs, she was developing pneumothorax so many times. Pneumothorax is a condition where air collects outside the lung,
Yes.
causes trouble breathing, chest pain, and things like that. And what she would need is frequent insertion of the chest tube. It's a procedure that we do usually in the intensive care unit. It's scary procedure for the parents who has not seen before. It's painful. So because of that establishment of the relationship, even though somebody else would be on service on call, but if they would see me, they would request me to do that procedure. And I was happy to do that for them. Not that I was more skillful than the other colleagues of mine. It was just the relationship that they had. And then eventually they saw that this is a procedure and everybody is as equally competent. And then they also allow other physicians and other fellows to do that procedure. So I think it was a good journey of developing the relationship. And like Sidharth mentioned, looking at her, I can't even tell that she has suffered through that life-threatening event, and she was in the ICU for such a long time. So it's amazing to see, and it's rewarding for us. Not just that it helped us in our development, because like Sidharth mentioned, brain tumor and other conditions are becoming so common these days. So helping family is equally important as the medical management.
Absolutely.
So it helped a lot.
In my conversations with Devanshi and her mother, there were a couple of things that I noticed. First, they admitted the apprehension of accepting the diagnosis, as well as the fear of what lupus means to them and their family. Her mom was extremely emotional at a point where she was afraid to even speak of the journey again. God forbid, it all suddenly comes back. So that's how serious and that's how emotionally challenging and draining an autoimmune illness can be, not only on the patient, but as well as the family. The other thing that I observed when interviewing or having my chat with Devanshi and her mom, their comfort with their attending doctors. So as I'm speaking to the attending doctors, I can tell you, although you haven't sort of gotten a sneak peek into that interview and that conversation, the differentiating factor was the two doctors that were able to put them at ease, not only Devanshi, but as well as her mom, that she was in the right hands. Lupus can be a very confusing, life-threatening also illness. But at no point during the conversation did I feel that they were worried about Devanshi's life. Her mom kind of gave me a sense, but it wasn't really said up front. And I think it was because of their confidence in the attending doctors and the team that gave them the complete satisfaction that everything was being done that was necessary to make her feel better. As well as Devanshi did mention that as someone who was being treated, she did have sleepless nights, and then she had friends coming over, and that would make her feel better, but then she still wouldn't be able to sleep well during the night. And her mom also mentioned that she literally stayed out of the hospital, lived in the hospital for 6 months, I think, all the while that Devanshi was there. So it's beautiful to have you both here, since there is, Devanshi's story where she's with us and she's completely okay and healthy. And I don't know if you guys know, but she's been motivated to become a doctor because she, I think, has seen the difference that you guys have made to her life. And that's the reason why she wants to be a doctor in the future. So coming back to you, Dr. Prashant, I wanted to sort of ask you, um, what are the specific challenges? You mentioned one about, her having these tubes that were needed off and on to assist her breathe. Was there anything else typically that, a lupus patient does go through during their treatment? That was typical with
Yeah.
Devanshi also in this case.
Yeah. So the lupus, as you know, it's an autoimmune condition. It's a chronic, which lasts for years, if not lifelong. And it has a lot of remission and relapses, and relapses can be life-threatening as well. So the challenges that came were initially, when I was managing her, were related to getting the breathing tube out. I'm sorry. Getting the breathing tube out and getting her off the mechanical ventilation. That was a huge challenge because it's a chronic condition. And if it was an infection, I know that, okay, infection is over, take the breathing tube out and the child should be fine.
Yeah.
For her, it was like a chronic and relapsing condition. So I wasn't sure that, okay, if this is going to work or not, and would we need to put the breathing tube back again in or not. So that was one of the challenge. Then second challenge, that recurrent pneumothoraces. I remember, I remember, if I remember correctly, she probably needed at least 5 times the chest tube placement. And that too, after like the mechanical ventilation was off. So she was aware of what's going on and what's going to happen.
Yeah.
So that, but she dealt with it very nicely.
And she was very young. I must mention here, she was, I think, all of 9 or under 9.
Correct.
Yeah, because I did ask her, and she was all of under 9 and she was going through this. So she was very brave.
Indeed, she was very brave. Yeah. And for the first time, they were slightly apprehended. For the second and third time, they knew this is coming. This is the drill. This is what happens. And she gets better after that.
Right.
Then we were also, from medical standpoint, we were also talking, should we do pleurodesis in her, meaning put a chemical between the lungs and the outside surface so this doesn't happen. And that itself has a lot of implication as well. So from medical standpoint, that was a big challenge that was we were going back and forth at that time.
It was an important decision also that needed to be made.
Correct. So at that time, we were going a lot of back and forth on that. So, and eventually she did not need it. So I think I'm glad that we made a right decision, but I can only tell in retrospect.
Mm-hmm. So Sid, how about you? Do you remember any specific over and above something that Dr. Prashant has mentioned in terms of during her treatment?
Yeah, so, taking it back, if you think about the different organ systems that were affected in Devanshi, we start with the fact that she came in with kidney failure. Right? So her kidneys were badly affected from the lupus. That's what brought her to the hospital to begin with. Followed by the fact that she had multiple pulmonary complications. I think, and Prashant, again, correct me if I'm wrong, I thought she had a cavitary pneumonia as well.
She had fever. Her mom has loosely mentioned that she kept having fever. And that was there for a very long time, yeah.
Well, because, you're walking on the razor's edge on trying to immune suppress the patient in an environment that has infection everywhere.
Absolutely.
And then, exactly, and the child requires multiple instances of placing an endotracheal tube in, which can increase the chance of infection. So that's kind of the opposing priorities there, treat the underlying disease, or now that there's an infection, treat the infection and, allow the underlying disease to flare. So you have a problem with the kidneys, you have a problem with the lungs, you are, I guess, putting a problem with the immune system, there's infection. Yeah. So this is why, we consider a patient with lupus critically ill and capable of having what we call multi-system organ dysfunction. Now, when you start diagnosing a patient with that, their mortality rate is very high. So, like I said, right off the bat, we knew that this is a sick child that has a very uphill struggle.
Yeah.
So more specifically, so Prashant, absolutely. If you ask anybody in my fellowship class about Devanshi and Prashant, and they would always say, yeah, whenever she needed a chest tube, you got to call Prashant because he's the one that could do it without a problem. And it's unfortunate to have that memory because that means she required so many of them, right? The fortunate part is that he was able to very easily take care of the procedure, and actually procedure-wise, he's being humble, but he was amongst the best. So, I mean, I would definitely trust my child in his hands. So what I remember very clearly, and again, something that didn't come from a diagnosis, but more from a conversation, was the first time that we intubated her. I remember it was me and my attending Dr. Christina Alvira. And we had to do it for a biopsy, meaning to take a piece of tissue from her lungs to diagnose the underlying problem. Aside from lupus, could it be, there's something called interstitial pulmonary fibrosis that can happen with lupus. So is that part of the reason that her lungs are sick? And her mom was having a very hard time with this. Now, it was going to be a procedural intubation followed by removal of the endotracheal tube. Again, something that we do on a regular basis, and we don't even think twice about it. However, when it comes to a child, that's already a big deal from a parent's perspective. But what I learned after talking to the mom, this was when we were kind of building our therapeutic alliance and building that relationship. I learned that mom's dad, so mom's father, had died with a ventilator with an endotracheal tube within him. So she linked the two, that placing an endotracheal tube in a patient means that's the final destination. And I didn't appreciate that because I didn't know. And so further conversation with her, and I found out, and I spoke to my attending about it, and I said, this is a very, very big deal for them. They're not ready for this. As soon as you put the endotracheal tube in, for them, it's a full stop, it's over. So Christina said, well, we're going to put it in, do the biopsy and remove the tube, and you're going to do it. And I was obviously nervous, but at the same time, I said, this is what I'm charged with, and we got to take care of her. And so we did. We intubated her. I even remember the room. It was on one side of the ICU, and we did the procedure, and I was waiting to extubate her, and we actually got the whole thing done within a couple of hours, and she did fine. She woke up, and everything was fine. So I think that was one of the small victories that the mom saw, that this team really knows what they're doing. They have our child's best interest at heart. They are serious. And so let's see where this goes. And so I think the trust began to build from there, and there was a therapeutic alliance, which has now become one of my priorities anytime I take care of a patient. It's to establish a therapeutic alliance. And that therapeutic alliance means that the parents and the doctor are on the same page in taking care of their child.
Yeah. So my takeaway from this is it brings back a lot of memories for me too, where going into a hospital, only you said the background that I'm speaking of. If somebody were to ask me to go to a hospital, it's either because it's really, really serious and there's no other way around it. And every time that I went in and every time they would want to poke a needle in me, it would just bring back memories. So to bring the audience here up to speed, I've lost two family members to very close family members to life-threatening illnesses. I mean, specifically cancer. So every time you go into a hospital as a patient yourself, the first thing that comes into your mind is that this is it. And every time somebody wants to stick a needle in you, it brings back all kinds of memories about somebody else having gone through this procedure and you being in the room sort of witnessing it. So the other thing that I picked up from Devanshi's mom was that she was she admitted that she wasn't very easy with the doctors. She did mention that she would, well, she even said to the point that I was fighting with every doctor because I wanted to know what is going on with my baby. And as a protective mother, she has every right to do so. But so, this kind of loops into what you were saying, Sid, that there had to be this very important relationship and bond that had to be built of trust. It's something that every autoimmune patient needs. Not every patient also, otherwise also, but an autoimmune patient specifically. I'll tell you why. Because as an autoimmune patient, it's not only about the specific illness that you're sort of trying to deal with. As you mentioned, it's also every other thing that you're being exposed to while you're being treated for what you're being treated. And that is, again, something in common that I see between her journey, my journey, and three other people, four other people, and so many other people I've been speaking to. That for us, it's not about one particular illness that you're tackling. It's an infection. If you're having something a tube going into you for whatever reason, you're wondering about picking up an infection from that tube, and you're already dealing with the existing autoimmune disease. So the challenges with the doctors are plentiful. I think when you're dealing with an autoimmune patient specifically, and in Devanshi's case, I think there were many, many things on the platter that needed to be handled. So we've sort of walked through Devanshi's story, and we've sort of understood that when she came to your care, she was at a very critical stage of her life. She was fighting for her life, and so was her family. Having treated her, and today she's seeing her as a very happy, healthy child. When she was getting better after the first triumph and everything, how did it make you feel as doctors in terms of her whole discharge? Her having to sort of being weaned off one medicine after the other, and she's sort of doing better every day. As doctors, can you tell me a little bit about what kind of emotions you were going through, and specifically in her case, because I think it was one of the biggest challenges you may have seen. Dr. Prashant, you want to take this one first?
Yeah, sure. So in this country, most of the things are in group practice. So we are on service for a week, then somebody else comes on the service next week. So it's a shared decision. It's a combined responsibility. So the reward is also shared. So on one side, the responsibility is shared. On the other side, the reward is shared. In Devanshi's case, Sid and I took full responsibility from the get-go, and we were making sure that she remains on our team. So Sid intubated, put on the ventilation, and he made sure Prashant takes over after me and make sure she gets extubated on time. So in this case, a complete reward was to us.
This is
and
regard, I think.
Yes, yeah. So yeah, it was an immense pleasure. And then because we got at the personal levels, this type of situations are not just the medical management. It's a comprehensive management, working with the family, their involvement, their education, and building trust between the physician and developing the physician-patient and physician-family relationship.
Yeah.
So that was the biggest thing that I learned. We learned diagnosing and discharging and all sort of things from every patient, but this was the most important thing that I learned from this family.
Wow. Sid, how about you?
I'll relate her actual date of discharge. I think that was one that I'll never forget. Even Prashant won't forget. I was at home because I wasn't on service. I always have my pager on me, and suddenly I got a pager to Devanshi. See, we took such close care of her that we knew exactly where she was on the floor when she was not in the ICU. Mm-hmm. And of course, Prashant knew because he was running back and forth every second night to put a chest tube in her, so he knew exactly where she was. So I got a page. So I think it said urgent. RN call back to this room number, and I dropped everything, and I'm like, I'm not calling, I'm going straight to the hospital. Right. And I remember arriving there about the same time as Prashant, and we both were like, oh, it can't be, this cannot be happening, it's been 6 months, what's going on now, right? We get into the room, and everything's packed up, she's ready to go, and she's like, you weren't going to come and say goodbye to me? And I couldn't believe she did that. But it actually gives you some insight into how much we had grown to care for each other.
Yeah.
We were family. That's the best way I can describe it. And she, had again, she had huck. She had this right over her, over her doctors. And that was heartwarming because, like Prashant said, we take care of so many children, but we are one amongst many who take care of those children.
Yes.
And we rotate on and off, and we could be spending a few days and then a few weeks off. And so we often don't get to build these kind of relationships. So when we do build these relationships, to me, it's extremely important. And as you can see from her journey, it didn't stop in the ICU when she left the doorstep of the ICU. It didn't even stop when she left the doorstep of the hospital. We continued our friendship, and we're still friends. We text back and forth. Yes. We share birthday pictures. She still rags us for forgetting her birthday. It's a very fun relationship. So I agree with Prashant. I think serendipitously, we took charge, or the charge was given to us. Because I remember all the attendings saying, if you have any challenges with this family, call Sid or Prashant,
Yes.
which was fine because we're also senior fellows. So
Yeah.
it is in two different ways. One, with the family being so close to us, and two, because we're senior fellows, it was okay. But it was a kind of inside joke that if you want anything done with this family, you need to talk to the two of them. So instead of being, the fellows, we were essentially the primary attendings for this child. And I actually appreciated that Prashant was there sharing that responsibility, because it's a huge responsibility. I mean, imagine when things went south, when she needed the second, the third, the fourth, the fifth chest tube, the multiple number of intubations. Again, it was the two of us, and it was stressful but shared. And thankfully, things kind of went in a good direction. It's heartwarming to see this journey, but I think it's testament to a very important thing. And it's interesting for me to say this. It is not the physician alone that can heal. And I'm going to say the word heal, not treat, not cure, but heal the patient, right? The patient, especially a pediatric patient, requires a multidisciplinary approach in which the family plays a critical component. So when Devanshi saw that her mother went from fighting everybody to accepting, I know for a fact that Devanshi herself began to feel comfortable, and she began to express her personality, and she began to realize that, yes, I can actually fight this because I've got my parents and my doctors fighting for me, not fighting each other, but fighting for me. And in a metaphysical way, I think that at the end of the day helped her beat this.
So two things that her mom did say. She called her doctors, and she was again referring to, I think, the two of you primarily. She called her doctors family. She didn't say doctors. She said they're our family. So that again corroborates and sort of kind of brings out the kind of warmth and the deep relationship of trust. That's very important for patients while they're being treated in and out. The other thing is that that Devanshi mentioned, and she said that initially it was about not knowing what's going on, but afterwards it was about, you're going to be okay, and everything's going to be okay, and everybody around her was telling her she was going to be okay. So in her language, everybody means her environment, which is her mom, her dad, her doctors, the two people here who are always around, hovering around her whenever she needs medical attention. And then there's the trust that she's going to be okay because Dr. Prashant is there or Dr. Sid is there, and she's going to be okay. So she admitted that from not knowing what was going on and being scared to her journey of being, she's going to be fine and she's going to fight this. And this is just, something that she has to go through. So that's a huge sort of huge win for you guys, just to know that, she has told me this in our little chat, and she truly believes it. So it sort of, the whole full circle comes back saying how important it is for doctors to build that level of trust with the parents, and for autoimmune patients to have their support systems and friends and family, and to be able to trust their doctors, and be able to get treatment from their doctors whom they trust. So to kind of loop this whole thing together, Dr. Prashant, have you sort of attended more autoimmune patients after Devanshi at some point? And if you have, then what kind of common advice would you have for people who are, come to you at a certain stage and they really don't know what's going on, or they're being diagnosed, and then, what kind of sort of common advice would you have for people in this situation?
Yeah, it's a very good question. Yes, from time to time, I do take care of a lot of patients with autoimmune conditions, and there are many other conditions like myasthenia gravis or certain chronic cancers. Right. So those are very chronic conditions with relapses and remissions, and they often come to the ICU from time to time. What I try to give them example is that I'm going to steal the words from Sid that he once told me that don't let the disease define you. And I actually try to find a famous personality that has that particular disease. So one of my patients had myasthenia gravis, and I found a list of the famous celebrities who has myasthenia gravis. Like one of them was Aristotle. And when I told him, and his eyes were like completely wide open, that wow, the Aristotle had it, and see, he still made and did everything that he wanted to do in life.
Right.
So that's what I tell them. And along with that, what I also do is try to establish a comprehensive relationship with the families, not just understanding the medical aspect of it, but the other challenges they face at home dealing with the child with the chronic illness.
So just to follow up quickly, do you see a difference between an autoimmune patient and the kind of situations that they face inside the hospital, outside the hospital, in their general environment of being in this situation, and from other illnesses, like other chronic illnesses that you see otherwise while attending to ICU patients?
Yeah, I mean, there is always an emotional stress that they're facing. In the back of the mind, they always have their a label that, okay, I have this condition. So, and that affect their personality a lot. Some of them, like Devanshi, take it very well, and then they become very positive personality. And certain even children, I've seen that in the development, some of them become complainers, some of them become that tolerance becomes less and less with every single illness. So having multidisciplinary approach that helps a lot.
Would fix that, yes. Yeah. Sid, how about you? You, after sort of, I know that you're not primarily into autoimmune illnesses, and your stream is a little different, but could you share more of that with us in terms of if a child is in an ICU unit with you under your treatment or in your hospital, the kind of challenges that they would face inside the hospital, outside there, after they get diagnosed, when they go back to their regular lives, and what kind of things affect them?
Right. So, the autoimmune umbrella is really an umbrella term for so many different conditions.
Right.
Them having its own, pathophysiology, its own trajectory, its own pattern of relapses and remissions. So it's a pretty broad diagnosis. Now, unfortunately, children do face it, maybe not to the same incidence and level as adults do, but they still do.
Yes.
And their challenges are different. They're unique because they're children. They don't understand. And no matter how many times you try and teach them the diagnosis, they're not going to understand because it's a chronic illness that can flare at different times. It doesn't necessarily get cured completely. The body may be at some point in a state where it starts, attacking itself for whatever reason. And they're left without consistency, without an ability, right, and without an ability to control it. Yeah. And I think that's the hardest thing with children, because they feel this loss of control. And as Prashant mentioned, some of them spin that positively and some of them spin out of control.
Yeah.
But I'll say it again, it's so important that the physicians and the family, and I'm going to say it's the physician team, right? So while Prashant and I seem to be, touted as the heroes of this story, I want to make it very clear. Absolutely. The rheumatologists that took care of her, the nephrologists that took care of her, all of the ICU attendings that took care of her, absolutely, all the floor attendings that took care of her, the entire team is what made her better.
Yeah.
We were lucky to be on the receiving end of Devanshi's, praise and love, but it's so important to know that we didn't do this alone.
It can't.
And there's no way to do this alone. So it's that medical home that needs to get established for each of these patients with autoimmune conditions, because once they discharge from the ICU or from the hospital, they have to go outside and live their lives. And outside, they have a primary physician, a rheumatologist, or a nephrologist that's taking care of them. Those individuals then connect with the hospital in case the child needs to be admitted. And over time, then, that relationship becomes very established and the family gets placed at ease. But in the initial phases, no matter which child I take care of right now, the challenges remain very similar to Devanshi's. The simple acceptance, the understanding, and the foresight are all lacking because it is just something that is hard for a family to fully grasp at the first admission. It's not a simple cold. It's not even a pneumonia. It's not something common. It's rare and it stays with you, unfortunately.
Yes.
So I'll just say one more thing though. We're currently in a COVID-19 pandemic. Right. One of the sequelae, one of the results of a COVID-19 infection is something called multi-system inflammatory syndrome.
Yes.
Also called MISC. MISC is an autoimmune condition.
Autoimmune thing, yes.
we still don't know what it means for children once they have it. But I've personally taken care of a couple of kids that have been very close to the brink, requiring all kinds of support in my ICU. And thankfully, they both did phenomenally well. But it kind of takes me back to Devanshi and takes me to all the autoimmune kids that we've taken care of to make me realize that this is not necessarily the end, unfortunately, and that we have to be careful. And this family needs to be one that we kind of walk hand in hand with. When I say we, the medical home,
Yes.
and taking care of the child for the next, X number of years until they have taken responsibility for their condition or until their condition is not something that's debilitating.
Yes. So what the one thing that I do agree with completely, and that comes out in both of what you said, through an for an autoimmune patient, you're speaking to at least 5 doctors at a time. You're speaking to your GP who guides you to the endocrinologist, who's also talking to the hematologist, who's also talking to the neurologist, who's also talking to the bone doctor, who's also talking to, and if everybody's not talking to each other, you're kind of running from pillar to post trying to figure out what's going on with you. And then there's, of course, the primary disease or the primary condition, which is the autoimmune piece, which still is going to play its role. So it's very important that not only the people who, your primary doctor, but everybody else who's affecting or impacting the primary problem or the condition is also in sync with a good result for a patient to go back home healthy and hopefully never come back. Although for autoimmune patients, that's, you've got to accept that we keep coming and going. We're like visiting faculty. We keep going in and out of hospitals. Not to belittle it, but that's the joke that we always have, that we're gonna keep going back to our doctors. The difference that has been made in my life personally, I have seen, is to have doctors who talk to each other, and they sort of build a team. And that takes me to what I want to say to sort of end this discussion, is that the talking to each other piece is so important. So as autoimmune patients, it's very, very important for us to be talking to each other, to be able to figure out what makes our lives better, to be able to manage our illnesses better. At the same time, it doesn't mean that I have to be speaking to another autoimmune hemolytic anemia patient and that I cannot take inspiration from Devanshi's story. Just the fact that she is off her medicines and she does not require any kind of going back and forth between doctors, and that she's a beautiful, healthy child looking forward to being a doctor, is inspirational. That gives me hope at the end of 20 odd years that there is an opportunity still to be able to get away from the medicines that you're taking on a daily basis. And this only happens through these conversations. So the attempt here at autoimmunity.in is to bring these conversations together, these stories, and the fact that there are these doctors who have treated these patients and these people and their caregivers, not only the people who have the condition, but the family, the friends, the primary caregiver of that person who needs to accept and understand that this is a condition that's going to be around for a long time and how best to manage it and to take it positively. So these conversations are so important. This connection, this sharing, this inspiring is so important. I'm going to end. Do you guys have any advice for patients who are struggling with autoimmune illnesses or chronic illnesses and who are little children, Sidharth, in your case? What would you want to sort of leave back as 2 or 3 motivational words for who are going to be watching this?
I think for the patients who can understand what they have, I would simply say that there are a lot of us that are here to help. Seek us out, trust us, even when it may be difficult, because it seems like the doctors don't have time for you. The doctors are trying. They really are. They have your best interest at heart, and they want all stories to be like Devanshi.
Yeah.
And that's for when you come to the hospital. What about outside? Like Prashant mentioned, Aristotle had myasthenia gravis, and he was one of the greatest minds of all time. So you can be too. So don't allow the disease to stifle your potential. Don't get flustered by the fact that you have a condition. Everybody honestly has some issue, has some problem. Okay, and we all realize what these are, and we take it in our stride, and we learn to make the most of it. So, I would say, do not let the disease paralyze you. It's a disease, and there's medical science, and there are people that are there to take care of you.
Yes. Dr. Prashant, what would you
Yeah,
like?
nice.
Parting word.
Yeah, sure. Yeah, nicely said. I would second that, and I would say that just remember that you are not alone. Everybody has some or the other problems, and there are many other people out there in the world who has the same problem. And you will find someone who would be able to help you in all the way. So
Yes, absolutely. As I said in another chat with another patient on this platform, I kept reiterating to the person and to everybody who's watching this that this condition is part of your life. It becomes something that you carry with you everywhere. It's your best friend, best buddy, and you just cannot get rid of it. It's your companion for life. But it doesn't have to define you. It doesn't have to shape you. It doesn't have to define your present or your future. It's totally up to you to decide what becomes of this situation. And at no point, if you're looking forward, there are enough people in your today to be able to guide you through, whether it's great doctors or whether it's communities like ours or whether it's great medical institutions that can guide you through your illness. You know, all of this put together is this positive environment that can really bring you out of that negative situation and turn it into a beautiful one for you. So we're going to sign off today. I'm going to sincerely thank you, Sidharth, my best buddy, my childhood friend, for bringing Dr. Prashant and yourself and Devanshi to me. And I'm very grateful that you guys have taken out your time, giving us, I think, the middle of your day and the middle of my night to focus on and to be able to give out this message to people who are suffering from autoimmune illnesses. Thank you very much. And I hope to do this again with you guys, maybe over another topic.
Yeah, it's been our honor and privilege.
yeah, same here. Thank you for the opportunity.
Great. See you soon.
See you
Take
soon.
care. Bye.
Bye. Take care.